Hey, Molly, it's all about standards. There's a lot of data going back and forth. I know this is your favorite subject, and it's a super important one, right? I mean, everyone's had the frustration of, being at one clinician, being at another, can't get the data. Tell us about what's the state of the state on in the environment that you're working in.
Absolutely. And if you remember, standards are my favorite topic.
Yeah,
Um,
yeah.
no, so there's certainly a lot been happening over at the Office of the National Coordinator. Pat mentioned a lot of, tools that DHA is using that is helping better serve their patients. And a lot of that technology is grounded in, work that ONC has been doing to make sure that that technology functions the best way for both the patients and the clinicians who are providing care. And like you mentioned, Luke, to make sure that that information can be shared if someone is receiving care elsewhere. So if they have an emergency at a civilian hospital, are they able to get that information to the provider providing care there, in real time to make sure that their allergies are available, their medication lists are available. So one of the exciting things now that we're in halfway through 2026 is that we have some rules that will be coming up more quickly. Perhaps when I say 2027, it seems like a long way away, but with how quickly 2026 has gone by, we'll be there before we know it. So by the end of 2027, ONC certified electronic health records will have to be able to support electronic prior authorization. That's been a big
Mm.
priority in this administration, making sure that those prior authorizations that go between the clinicians that are providing care and the payers that are covering the patients, that those can be more seamless, reduce burden on both sides. And so by the end of 2027, they must be using electronic prior authorization capabilities, which we expect to save a lot of time. And over the next decade, we expect to save about $19 billion in labor costs. So that's a really exciting area. We've been doing a lot of work with our partners at CMS to do testing and to be ready and to make sure also that our regulations across ONC and CMS are moving toward that same goalpost. Um, Additionally, by the end of 2027, those same ONC certified EHRs will be working on patient-specific real-time prescription benefit information, which also means that as a patient, if my provider is prescribing a medication, they can see what the formulary status is, what an out-of-pocket cost might be for me, and then other lower cost clinically appropriate alternatives. So really giving some more ability for the patient to be able to make informed decisions, understand what their costs might be. As someone who is on some rather expensive medications, I'm really excited to be able to, be in that position to say, actually, let's do this one instead of the one that I've been on. So those are some really exciting deadlines that are coming up in 2027, and lots of opportunities to test with us. So I'll throw that out there if folks are interested. We'd love for you to join us. Lots of opportunities also to do some pilots. We're working very closely with HL7 Da Vinci and some of our other standards development partners to make sure that those standards are ready to go, and that we're really being iterative and consensus driven as we're moving towards those deadlines. So those are some of our top things that are bringing us excitement this year.